Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with Dr. James Flowers.
Hey, Robin.
How are you?
I'm doing great. How are you?
I'm good.
Good.
We're excited to have our special guest, Moe Schlachter.
Hello, Robin.
How are
Hey,
you?
Mo.
Doc.
I'm so glad that you're here today. I'm super excited when I found out that you agreed to do this. I know how busy you are. Thanks for making time to come over and be with us.
Absolutely. Thank you. I'm really glad to get the opportunity to talk to you whenever I can.
Yeah.
I know how busy you are, and it's really a pleasure to
you.
contribute to this podcast.
That's so cool.
Well, I thought I'd read a little tiny bio,
Yeah.
and then we'll go from there. Moe Schlachter is revolutionizing the journey to exceptional health and the full realization of human performance potential. He's a registered dietitian nutritionist and a certified diabetes care and education specialist. Moe is the president of Houston Family Nutrition, Inc., the premier destination for clinical nutrition care and wellness guidance. As a leading expert in his field, Moe is routinely featured on local affiliates of ABC, CBS, and ESPN television and radio. Thank you for agreeing to tape this with us. We're
Yep.
excited.
No,
and
thank
you
so
left NBC off of here. I was in Los Angeles one day and turned on the 5 o'clock news, and he was on the NBC National News.
I
Oh,
did,
really?
Yeah.
I did leave NBC off of there, and that's how we connected.
Yeah.
It was a series of collisions where I went to, I think, a spiritual networking event, a spiritual care networking event,
Yeah.
and then met an associate of yours and got to do a presentation at one of the rehab facilities. And then through that, we were just playing phone tag and never really connected. But then I get a call from Dr. Flowers, over from Los Angeles, saying that he just saw my face on TV.
That's cool.
Yeah, that was very cool.
Yeah, well, that leads into, that's a great segue to what I asked you earlier about that ESPN Zone thing. So you were watching ESPN Zone, you text them while they were live or something?
So soon after I opened Houston Family Nutrition, just going to networking meetings and going around town, listening to the guys on ESPN and heard them talking about their New Year's resolution. So it was around, January time. And then, just texted in just for kicks saying, hey, if you guys are kicking it around about weight loss, you really ought to talk to a registered dietitian. One thing led to another, and then I was kind of leading a Houston-wide listener weight loss contest on ESPN radio, and really put me on the map and the company on the map. Yeah.
Yeah, that's amazing. See, you just take every opportunity, right?
Yeah.
When you see something, grab it.
That was good.
Take the chance. What is? I love how you say full realization of human performance potential. Tell me about that.
Yeah, in working with clients or clients coming to to Houston Family Nutrition and to J. Flowers, typically there's maybe an ailment that they have in mind or something that they want to fix, but at a certain point, there's the conversation to be had about what is possible, from a point of strength, right? So it's not just kind of fixing what's wrong, Of course, that has to happen when there's an ailment in place. But bigger picture is what is actually possible. Like what can we achieve? How far can we push our body athletically? Or it could just be how much peace can we get from our brain on a day-to-day basis, or how much clarity, how much focus, how much of the things that we love can we immerse into, and how far can we take that? And I see our company helping people do that through the direct care that we are providing, but also through referrals and collaboration with other providers, helping them see their blind spots, knowing what we can help them with and what we can't help them with, but connecting them with the very best resources so that they can get from wherever they're at to really reaching their wildest dreams. And that's something I ask every single client on the way in. I said, try, if you can, just remove any kind of limitation. And if I was a genie, what would you wish for? Like, what would you actually, like, what is your biggest wish? And how can I help you get there? And, once someone can verbalize it, we can make it happen. It kind of sounds a little like Disney-like, but the truth is, it's possible.
I couldn't agree more. I always say if you can see it and visualize it, you can achieve it.
Yeah.
Right? You can. As long as you put it in your mind and you can verbalize it, see it, visualize it, put it on the fridge, in your mirror, or whatever it is, you can get there.
Yeah, recently I had an intern, come to the clinic. So we have interns who rotate in and out with us. And she was only going to be with us for 4 weeks. And, it's a relatively short amount of time. And on her first day, I said, what would you like to achieve in this learning experience? What is your biggest wish?
Right.
And it took some coaxing out of her to really get her to dream a little bit bigger than, maybe saying something that seemed attainable. I said, what is something that is unattainable that you want to achieve during this experience so that you and I can prove that this concept works? And she said, you know what? I want to present nutrition in front of oncology, pediatric oncology patients.
Wow.
And, with coming in with no experience, coming in with, not a whole lot of connection, I said, okay, you said it, and now we're going to work towards it. And from there, her efforts got behind it, and through networking, through, diligence, through being resourceful, we made some calls that gave, kind of introduced to other people, and lo and behold, she got on, someone's radar, and she got to, get her experience. Now, it's a small little thing, but what was really great was she just let go of any limiting belief,
Right.
and just said, this is what I want. And just through that, she got there, and she, it was a remarkable experience to be a part of. Yeah.
How old are your patients? I mean, what's the age range from?
Yeah. So we're a family clinic. So, Houston Family Nutrition, we see, members of the family from all, stages of life. So we'll see parents who have, concerns about infant or even, expecting mothers, all the way through, geriatric years. So we're going to treat each stage of life a little bit differently. Typically if there's a nutrition concern for a smaller child, we'll work more directly with the parents. If it's an adolescent, we'll work with the parents and with the child, collaboratively. And then when an adult is on their own, we'll work one-to-one with the adult. But we're seeing folks of all ages.
What I was thinking is nutrition is such one of those things in the world that, if Moe Schlachter would never sit with a patient or a friend or anyone else and offer psychiatric advice or counseling advice or medical advice. But everyone offers nutrition advice, right? Your doctor does, your physical therapist does, your chiropractor does, your counselor does. I do. We all, girlfriend, we all do. Why is it so important to see a registered dietitian rather than listening? Certainly, people can be knowledgeable, right? But you're a registered dietitian, so talk to us about the importance of that.
Yeah, that's such such a great observation by you, because food is both simple and complex at the same time, right? It's also something that's not super important, but also critical and very important at the same time. And so it can be complex. For instance, it could be simple. I should say. You don't need a prescription for it.
Right.
Everyone eats it. It's not it's not something that you need any special license to kind of handle and hold and eat, right? But it is complex because, and here's the proof, right? There's a $20 billion diet industry, right? If food was simple, there wouldn't be $20 billion in these diets, right?
That's right.
And it's projected to balloon 10 times that amount by the end of the decade.
Yeah.
So I guess that shows like the two sides of it, and it's also simple in a way, but really, I guess critical when it comes to athletic performance, right? So all the major sports teams are investing in their nutrition.
Right.
You think about nutrition for disease. You think about the very simple fact, as corny as it sounds, you are what you eat. But the truth is, our bodies are only made of the food that we eat. Our cells, under a microscope, it's all components of food. So food is critical. Now, people give themselves license to kind of advise on food because it has the simple side of it. But when thinking about how important it is, it really is important to seek a registered dietitian. So a registered dietitian is the only licensed authority on human nutrition-related conditions.
Wow.
Okay, so when you think about the protection you have going to a doctor, the license that hangs on their wall is your evidence that the doctor is going to treat you with the best of what science has to offer. They're not going to go outside of that. They're not going to be experimenting on you, right? The same thing is true with a registered dietitian. We are legally bound by the science because we're licensed by the same boards that doctors are. Additionally, registered dietitians are trained. We get a master's degree. We also have residency, like a doctor has residency. We have to supervise under established practitioners. And then we also have the licensing exam and continuing education requirements. So, when you see a registered dietitian, you're seeing someone who is active in the field and staying on top of the research because it's required of them.
Right.
When you see anyone else, they might be knowledgeable, but they don't have to be knowledgeable. You might be seeing someone who isn't quite as knowledgeable and isn't skilled to identify issues that require, kind of critical manipulation of the diet.
Got it. And a lot of people interchange the words nutritionist with dietitian.
Yeah.
What's that all about?
Yeah, so that's been kind of a pain point for the field. So we used to be known as registered dietitians as a way to differentiate ourselves from maybe just nutritionists. So registered dietitian was a legally protected name that nutritionists couldn't use. But now we want to commandeer the nutritionist name too. So now we're known as registered dietitians or registered dietitian nutritionists.
Got it.
And the main difference, between someone with the registered dietitian part and anyone else is that licensure piece. Additionally, a registered dietitian, training includes the food science, but also the psychology of human behavior,
right.
And finally the physiology, right? So the way the human body works, the way the human body interacts with medications and other substances, and also the human body under disease conditions. Anyone else, say a personal trainer giving out nutrition advice, typically they don't have that. The training on disease states. They don't have the training on medication. So they might not even know to assess for things that are really critical. Whereas as registered dietitians, our practice starts with assessment before we diagnose and then intervene.
Got it. Okay.
Isn't a lot of what you have to do, though, is breaking the bad habits and patterns of families? Because doesn't it really all start with how your parents, what they fed you and what their eating habits are, and breaking that cycle?
Sure. That comes up a lot with both my adult clients and, of course, child clients. So with my adult clients, I'm taking them back to their own childhood and asking them about their experience at the dinner table growing up. Because that 9 times out of 10, if someone is identifying as being a picky eater, for example, we just so happen to find that in childhood they weren't exposed to very many, fruits and vegetables or the foods that they're just finding themselves not liking. Now, as an adult, they look around, see other adults eating it, and they don't know what to make of it, and there's this identity of being picky or, maybe allergic or, just kind of unable to access those foods. Sometimes we see families will approach us with a desire to have us help their kids make different choices, right? But a lot of times it's working with the parents on how are they exposing their children to these foods. So worked with a mom who I guess when she came in, she had 3 kids. All of her kids had different quirks around the dinner table. She found herself making 5 different dinners.
Oh.
She found herself, being in an unfavorable position as a parent to be the food police, for some of her kids. And it was just a really hard experience for her. But in working with her and helping her realize that she is the parent, she has the authority. She's the gatekeeper of the food. She's the one who, the children are looking at, for example. She realized that, she, through being a role model, through being a fair, firm, and consistent parent, around the dinner table, she was able to find a lot of peace around dinner time. And by the time she left, she was down to making that one dinner. She set the expectations. There wasn't any drama, and she was able to kind of change her style and really resolve everything that she was concerned about early on.
She took back the power.
That's right.
Yeah.
She stepped into the power that she maybe lost some touch with, for sure.
Yeah. That's so cool. Sounds like a lot of the patients that we work with, and some that we work with together. Can you think of a patient that you've worked with? At J Flowers, we work with a lot of highly complex people, mental health challenges, addiction challenges, medical challenges, sometimes one of those, sometimes all of those. How have you been able to impact the lives of some of the folks that you've seen? Maybe pick one and think about it.
Yeah, a few come to mind. But first, I also want to just express appreciation for, the impact and power that, the J Flowers Institute has on, the lives of people who are really stuck, lost, and sometimes, they arrive a lot of times hopeless.
Yeah.
And one story in particular stands out from nutrition standpoint. Someone who arrived by ambulance, and the first time that I got to see her, she couldn't tolerate sitting in an upright position for more than 30 minutes.
Right.
So our session was really, pretty short. But as it turns out, it ended up being the most important 30-minute conversation of my career.
Wow.
I saw in this person that she was at a crossroads. She had seen, many different medical providers in the past, many qualified and unqualified nutrition providers in the past, and she was so malnourished and so close to kind of losing herself. She was also fighting with all the different messages that had come her way. She was at the crossroads she was at was, is food hurting me? Should I be restricting more of my food? Should I be, taking away more of my nutrient sources? Or should I take a chance on food and see if it can bring me back to my strength? And I can't really tell you exactly what I did to talk her into, the path of choosing food, but it turns out that that's what she did. And from that minute, she was committed to getting as much nutrients going through her bloodstream as she possibly could.
Yep.
And she is a different person today. I got a chance to speak to her for the first time in almost 1 year.
Yep.
So I really just have a before and after perspective. In the meantime, at J Flowers, we were able to provide food for her and literally spoon feed her back to health.
Yep.
She wasn't
Literally.
Yeah, she wasn't able to brush her teeth or feed herself. She was literally spoon fed back to health. And I almost didn't recognize her in talking to her. She's so vibrant. She's so full of life. She's so clear. She's so and she's in such a powerful position. It's phenomenal.
That gave me goosebumps.
Yeah,
That's
me too.
Awesome.
I recently saw a photo. You saw her the first day she arrived. I will never forget that. That day in particular. But I remember calling you about this case, and I just saw a photo of her today versus a year ago, and no one who doesn't know this woman would say it was the same person. Yeah. Even some people who know her wouldn't say it's the same person. And nutrition was such an important part of bringing her back to health. There was a lot of chronic pain, a lot of injury, a lot of trauma, a lot of depression, things like that. But nutrition was critical. And you guys brought in a chef and prepared meals, and talk a little bit about that, about what you do, how the length that you'll go to help your clients.
In stepping out in opening Houston Family Nutrition, I identified the power that we as counselors, that as dietitians, we as counselors have to impact behavior, beyond the office visit. So we, through evidence-based counseling techniques and understanding human behavior, we can help people move the bar even if we're not actually spoon-feeding them.
Right.
However, there are situations like the case we just talked about where that is necessary. We cannot expect the individual, whether it's a child or someone with a handicap or someone who is dependent on others for basic life necessities. We can't expect them to kind of take recommendations and execute independently. So we are able to meet clients in that way by connecting them with resources that are either outside of our company, or we have very flexible team members who can counsel on one day, but then take a client to a grocery store on another day and cook for them or with them on another day, help them learn cooking techniques, help them learn how to shop differently, but also cook for them and feed them if need be too. For our eating disorder clients, we have one-to-one supervision options where we can have a team member during mealtime just sit and coach a client, something that they typically only can access if they're in a residential facility. We're bringing that to the outpatient side in order to, help kind of bring the structure that works back home.
Yeah.
Well, now that you're on that subject of eating disorder, so you two have been cooking up a little project here, and I could be telling stories out of class, but I'm just going to bring it out and see what you're willing to share. Share with the project that you two have been
we've been
discussing.
talking about this for a long time, several months anyway. There's such a huge problem in this area around really the world, the United States. And of course, we have one of the top experts here, and Moe just started talking with me and Michael in the office, and it just kind of evolved. So Moe, why don't I'd love it if you introduced it and told the audience what we are so excited to do with you.
Sure. Yeah. Eating disorders is really the purest connection of like neurobiology, psychology, behavior, and also nutrition. And one thing that consistently, hit me with every case that I collaborated on with J Flowers, is just how powerful this care environment is that you've created, and also how deep we can go with clients and really just help them on that kind of whole life, whole health level.
Yep.
Eating disorders, of course, huge problem in the country. I think statistics will say like one in every 10 Americans or so might develop eating disorder in the course of their life. But besides for the eating disorder itself, it's the relapse rates that really struck me. So about 1 in 3 or 1 in 4 folks with anorexia in particular will relapse, which is staggering.
Yeah.
And the reason, just in seeing clients at my practice, I'll see folks with anorexia on an outpatient basis, typically about 6, 7, 8 weeks out after residential treatment, because they've gone to residential, they've restored weight, and now we have an individual with anorexia with an intense desire to be thin, who has discharged from a residential facility, and now they're maybe the biggest they've ever been, and they've gotten there really quickly, and they're just kind of discharged home, maybe with some guidance and some instruction, but it puts them in a position where relapse is almost inevitable. So what we've been talking about is almost like a bridge between that residential and the home life, where we can give a family an intensive, just kind of a boot camp, a 1 week where you come and you learn the rules that need to be in place to keep the child home and prevent that relapse.
Yeah, absolutely. I'm so excited about it. an intensive really means every day, Monday through Friday, right? It can be 1 week, it can be 2 weeks, it can be whatever the intensive is built to be. But in this case, we're looking at doing a 1 week intensives in this area. So I'm super excited about it. Yeah.
And you know, you think of a family getting to come, you know, in the luxury accommodations, they come here with a mission. You know, we know the disease is there. We know, you know, there's anorexia. We know they're back to the weight they want to be. But the challenge for a family is, you know, so in an eating disorder facility, just to put pull the curtain, you know, from behind it. There's a lot of, you know, there's a lot of structure that really helps an individual with anorexia just kind of get from point A to point B. Now, that same kind of structure is sometimes difficult to execute at home for a variety of reasons.
Sure.
But even if there's no kind of family issues per se, it's still difficult to be rigid with your child or kind of hold the line when you also have to, you know, share Christmas with them, right? So in a facility, you know, there's a little bit more of you know, tough love, so to speak. So we help families really, you know, bridge that gap. We help families be able to, you know, have that positive relationship with their child, but also, you know, kind of instill that structure that is going to be needed for the child to be successful at home.
So cool. You clearly have a passion for this work. How did you develop the passion that you have for this particular area of work?
Yeah, you know, I started my career as a chef. So finding that, you know, I had a knack for food and just really enjoyed being around it, and, you know, just kind of exploring it even further led me to the path of being a dietitian. Now, at that time, you know, I thought, being a dietitian is just being a, you know, a food guru, right? And in some sense, you know, it is. But what really kind of lit my passion on fire was the counseling training and the psychology of human behavior, right? Just why do we make the choices that we make? And the most powerful, you know, thing that really struck me was just the realization that, you know, I'm spending 1 hour with a client and the client is spending 160 whatever hours, you know, of his week without me. And they're coming back, and there are certain things, certain ways I communicate that can help them actually get things done, and certain ways that I communicate that isn't as helpful. So just learning, you know, learning the power of that, you know, really, you know, really kind of lit my passion on fire. I'll also say that, you know, the opportunity that we have as dietitians to really impact people's human experience is tremendous. I mean, there's nothing we do as human beings more frequently, you know, in our human experience than eating, right? So
true.
That's how some people show love.
Right.
Yeah.
You know?
So food naturally is in the center of quite a variety of things. And what I find is that it's just a very accessible portal into whatever's going on with the person. So understanding that, you know, food is a human experience, just like, you know, showing connection and love and conversation and exploration and joy, and knowing that you can, you know, see into someone's, you know, kind of a window into their soul through food is really exciting. Like I'll say, if someone's presenting as anxious or disorganized, or if someone is a people pleaser, I mean, all that stuff is going to show up in food, and the way they share food with others, or the way they, you know, allow themselves to eat in front of others, what food choices they make. So helping people recognize that gives them an opportunity to, you know, work on some maybe issues that are a little tough to work on. Let's say it's a relationship issue. If they can work on their stuff, so to speak, through food, it's a lot safer a lot of times for them to, you know, work on some of those skills that they can then translate into other areas of life.
Yeah. You know, over the last year, it seems that we've ordered from all of these apps to go food every night, and so many people are ordering online and ordering food to pick up and tired of being at home. What effect has COVID had on your clients and their nutrition?
Yeah, that's a great question. In the beginning, it was apparent that it affected people in two very different ways. For some people, right off the bat, they reconnected with cooking. They reconnected with, the time that they had to invest in their health and energy. There was an increased motivation to protect self from, catching COVID, especially for those who already had underlying conditions.
Right.
So there was, I saw some folks really find a different part of themselves. Conversely, there was a lot of anxiety around it. There was a lot of opportunity to eat for comfort, and there was less opportunity to move around and get active. So, I saw it kind of going a couple different ways. Ordering in is one thing. The opportunity, again, just the time and availability is another thing. But what's really cool is that, people are, relying on them. People are discovering different parts of themselves, in general. Yeah. And it's really great to, see families maybe spending a little bit more time together, eating together a little bit more, and finding ways to, enjoy food again in a way that maybe they just, weren't doing when things were a little bit busier.
Sure. Yeah.
Did your family eat together as a group?
Sometimes it wasn't a ritual. Depends on we were all busy and doing things, and some nights we had dinner together, and some nights we were on our own. So
Gotcha.
And some nights we would eat together, but not at the dining room table, right?
Oh, well, that was back in the day where we had, remember those little TV tables or whatever, the TV trays? Yeah. Because we loved to watch television and eat at the same time as a family.
Yeah. What about yours?
We did. Yeah, we did. We waited till my dad got home, and Mom always had dinner ready, and we ate as a group. There were 5 of us. It was crazy.
Oh, yeah.
It was wild. But
my mom grew up in a home where same thing. They all sat down for dinner and ate a formal dinner every single night together as a family. And I was like, we did that every once in a while. What about you?
We had it on the weekends for sure.
Yeah,
The whole family, pretty regimented. It was really great. Thinking back on, and I never thought much about it, to be honest. But in this work, really understanding that it's not, it's not a typical experience. Some people will have it, some people won't. But I can say that there are foods that, are normal for me just through that experience that maybe are, eyebrow raising for others. And I think tongue comes to mind as one of them. But just knowing that, yes, that kind of is maybe a food that's a little bit more fringe. But the truth is, it gets back to that exposure. A lot of people just, that's where they learn to eat. And, it's not to say that if they don't do it then, they can't do it as an adult. But the path is a little bit trickier.
Absolutely.
Well, we're running out of time, or we've run over our time, actually. What have we not asked, or is there something important project-wise that you'd like to mention that we haven't discussed?
Yeah, I'll just kind of, echo the value of seeing a registered dietitian. If you see your general practitioner every year to find out if there's anything wrong with you, then you see your registered dietitian every year to find out what you can do to kind of push your health to the next level and get ahead of any negative things. Following us at HoustonFamilyNutrition.com, on Instagram, Houston Family Nutrition, Facebook, Houston Family Nutrition. I believe that we're at the cutting edge of bridging the best nutrition science and the best human behavior science and helping people, everyday people, anyone, just kind of get the most out of their health. So if you want to get ahead of it, just follow us. You'll hear it from us first. It's just a pleasure to be with you guys.
It's so great.
Thank you.
One other quick story I'll just say, culturally, being Jewish, we had a Jewish family come from Jerusalem for an evaluation, the husband and wife, and you were able to accommodate their needs the entire stay that they were here and coordinate their meals and service and all of that. So talk just a little bit about that, because I want everyone to know that whatever it is, you can certainly handle as a registered dietitian.
Yeah, like Robin was saying before, food being a part of celebration, being part of family, being part of identity, and that's a really good example. I mean, when clients come to our clinic, it is important to recognize that the cultural significance of their food is sacred and is to be honored.
Right.
When I had the opportunity to work with the client that you're referring to, it was great to be in a position to help the team, just kind of understand the culture, which again speaks to the value of the communication of the team, the collaboration of the team, where we're going to meet the client, in the place that they're needing. But yeah, I mean, that is a super important part of the experience, and we're going to make sure that our clients are going to have their needs taken care of. And that's a really good example.
Yeah, cool. Thank you so much for doing this today. Yeah.
And if they want to reach you by phone, I know you had the website. What number do they call?
They're going to call 281-940-5878. Okay. And you're going to talk to Jen, who's a phenomenal administrative manager and our wellness guru. So yeah, you just hit us at 281-940-5878.
Great.
That's great.
And Dr. Flowers, if they want to reach you at the J. Flowers Health Institute?
Sure. Everyone look at jflowershealth.com or our phone number 713-783-6655.
Perfect. Yeah. Thank you again.
Thank you.
Thanks, Mo.
Right.
Appreciate you so much. Yeah. Thank you, Robin.
Thank you.